All right, let's switch gears a little bit. We are going to go to Diabetes Alert Day. It's a reminder to check your risk for type 2 diabetes. And joining us is Dr. Burhain Siyum from Wayne State University to break this all down. Dr. Siyum, we appreciate your time this morning. Can you explain what Diabetes Alert Day is and why it's important?
Well, thank you very much. I just want to, because diabetes can be really deadly without really knowing that we or somebody have diabetes. And I can say about a third of patients with diabetes and about 80% or more of patients with pre-diabetes. Pre-diabetes means, those are having some sugar abnormalities, but not to the level of having diabetes. About 80% of them that they don't know that they have diabetes. So this alert day will help them to remind themselves, to check for possible diabetes or pre-diabetes.
Yes, it sounds like it's very important, especially for those who might be on the brink of that. You know, you're talking about your pre-diabetic patients. What are the main risk factors for developing type 2 diabetes? What are those risk factors?
So, well, there are a number of risk factors, which one of them, one of the most common and has been seen all over the world is of being overweight and obesity. And along with this, there will be also additional environmental factors and familial issues and some genetics as well. And epigenetics plays a major role of having diabetes. And in general, along with obesity comes sedentary life, not being really very active in burning calories, and then all this changes with modernization and also increase in the consumption of sugar and other tissues, fatty meal with that has been seen with improvement in the general standard of living.
Yeah, you were talking about some of the risk factors, maybe sugar intake or sedentary lifestyle. Is there one factor that puts one person more at risk for doing one or the other a little bit more? Or are all of the risk factors kind of equal in that?
I think, of course, there is definitely some genetic issues underlining. We're not really able to pinpoint which genetic issues, but in general, it's polygenic, which means it involves a number of genes as a background. And then otherwise, the environmental issues like, the lifestyle changes, the sedentary life, and then the increase in the consumption of refined sugars are equally play with causing diabetes, and obesity comes along with it also. They go parallel and hand in hand with increase in incidence and prevalence of diabetes with obesity.
So how can folks assess their risk for diabetes? Is it as simple as going to a doctor, or is there something they can do at home to maybe assess that risk for diabetes?
Well, in general, having a good lifestyle, having a healthy diet, doing exercise about, 5 days of 30 minutes of exercise, about 5 days of the 7 days of a week, and keeping the body weight with a normal body weight and with modernization of alcohol intake. I think those can give us a general clue. But like we have this alert day, then we have to really check our blood sugars, especially if it's pre-diabetes. Unless we do check the blood sugar, we will not be able to know it. However, like I said, if we are being overweight, that is a great indicator to tell us that there could be high risk of diabetes there.
Is there one age over another age that should be at risk that is at risk a little more for diabetes, or is basically anybody at risk? Or yeah, we'll just ask that question. Is there an age over another age that is at risk more than so the other?
Yeah, usually, we're talking about type 2 diabetes, by the way. But type 2 diabetes is very commonly seen above age 40. So anybody above age 40, being obese, having family history of diabetes, they have to really check for possible diabetes at least once a year, if not every 6 months. So that's very important. As we increase in age, the incidence of diabetes also increases. And actually, we say, if our life goes up to 200, almost everybody will become diabetes at the end of the day, which means our body gets the production of insulin gets coming down slowly as we get older.
I'm curious as to what the maybe symptoms of type 2 diabetes are, or maybe pre-diabetes. Maybe somebody is thinking they might have pre-diabetes, or if they do have pre-diabetes, they might have type 2. What are some of the symptoms that folks typically look out for when they're perhaps thinking they do have diabetes?
Yeah, again, I'm talking about type 2 diabetes. Majority of them actually they don't have any symptoms, and that makes it really more difficult really to identify. That's why we have some kind of alert day to remind us to check whether we have diabetes or not. Otherwise, the classic symptoms of diabetes are increase in urination and drinking water, and especially waking up during the night 2 to 3 times to go to the bathroom to pee. Those are good indicators for diabetes, but this is not seen in the majority of patients with type 2 diabetes, especially with those with pre-diabetes. There is none, there is no symptoms.
Interesting. For those already diagnosed, what are the maybe a key strategies for diabetes management?
The key strategy is mainly, that what they have to change in general with lifestyle change, which include exercise, weight loss, and healthy diet. Those are the most critical, very important. The nutrition itself, we call it medical nutrition therapy. By changing the diet itself, we can really significantly improve with the control of diabetes. And furthermore, if we do not achieve the desired level of blood sugar, then we have to proceed with the medications that we have. And luckily, this time we have a lot of very good medications that would control the diabetes.
Is there more so an emphasis on lifestyle change before you have to get into medication, or is medication typically recommended with any type 2 diabetes patient?
The best is lifestyle modification. Like I said, pre-diabetes. At this time, for example, 96 million people have pre-diabetes. And the progression rate from pre-diabetes to diabetes is about 10% per year. So all these people are heading towards diabetes unless they did some kind of lifestyle changes. So the lifestyle change is much better, extremely actually. This is study-based, evidence-based, that the lifestyle is much better than the medication. But when we come to a level that we need to have the medications, then the medications will help as well.
And for those who are unfamiliar with those medications, what sort of medications do you guys work with when that does come to that point?
We use, depending on the severity of the diabetes, we use on top of the lifestyle, always lifestyle changes, which include, like, again, I'm repeating it, weight loss, exercise, and dietary changes. Then the medications are, there are different, families of medications that we have to use. Because diabetes is multifactorial, we use also multiple ways of treating this diabetes. So we use combination of drugs depending on the severity of the diabetes level. We basically aim our strategy to achieve a good blood sugar control, which means we use because blood sugars really fluctuate, we use what we call hemoglobin A1C, or in short A1C. So we aim for the A1C to be below 6. If not, definitely has to be below 7. So to achieve this, depending on the situation, we use either single drug or multiple drugs. But most of the time, we use combination of drugs to achieve the desired level of A1C.
Okay, that's some good information there. I'm curious about certain communities and how diabetes could disproportionately affect some communities. What are those communities, and what can be done to address some disparities that are seen in the diabetes community?
Yeah, we see it basically like, this being overweight and having more prone to develop diabetes are in the low socioeconomic, and also the minority populations are much affected. I'm working here in downtown Detroit, so most of our people are affected by this diabetes, which we call it in general metabolic syndrome, that is associated with obesity, and also the lifestyle changes, and also the disparity that we have. All this really contribute to that.
One last question for you. I want to ask you just about your role as a doctor there at Wayne Health. What initiatives are you guys currently working on to combat diabetes in the state, and how are you guys implementing those in your community?
I think I wish I could be able to talk more about it. Unfortunately, At an individual level, there are some things that we were doing in the past. For example, we have done a screening at our in Detroit Receiving Hospital. We screened over 25,000 patients, and of this, we found like more than 60% of the patients. These are simply being screened coming to the emergency room for minor reasons. So of this, 60% and above were either pre-diabetic or diabetic. So the amount or the level of diabetes in the community is huge. However, after that incident, currently I don't know any community work, but we really need to work on that. And I hope if anyone like is interested, we are here to really help the community. But so far, I don't see any initiative.
All right, we have Dr. Sayoum with Wayne Health joining us. We appreciate your time, sir, and thank you very much, and thank you for bringing awareness to Diabetes Alert Day.
Thank you very much for having me.